Hi, I'm Dr. Robin Dickinson. For those of you who don't know me, I'm a family physician and creator of Dr. Robin's School, a health and human body program that teaches kids to understand their bodies and want to take care of themselves. We're going to be talking about first aid kits. Now, nothing I say here is medical advice. Even though I am a physician, I'm not your physician. If you have specific questions about your situation, you should be talking to your own doctor. This is just good common sense advice that honestly everyone should know, but isn't out there because it's way nicer for the people wanting to make money if they can charge you $30 for a very expensive box of Band-Aids. Instead, we're going to look at putting together your own first aid kit from things that you probably either have in your own house right now or maybe ought to have in your own house right now. That way you're ready for any situation that you might find yourself in. So during this video, I want to first go through kind of the theory behind first aid kits, because a lot of people just buy one without thinking about why they need it and when they'll use it. Then I'd like to talk about some specific situations where you might need some first aid kits. We'll go through some ideas for what you might have in those first aid kits, how to store them, when you might use them. I'm going to take you on a little tour of my own bathroom, show you a few real first aid kits that my family uses. So these are not the pretty Instagram-worthy, YouTube, Facebook, pretty versions that people always show right after they make them. This is the real life, actually used version, so you know it has something to do with reality. Then I want you to be able to sit down and make your own first aid kit. So you can download the workbook and answer the questions. You have the checklists of things that you can have in your first aid kit. And if you want to learn even more, you can also sign up for our Understanding First Aid course. Now, the Understanding First Aid course is not your standard first aid course. My goal is not to teach you first aid. You can take first aid courses all over the place. You might have helped your child through a first aid badge for scouts or all sorts of things. My goal is that you will understand first aid, because oftentimes you learn a whole bunch of random things that you need to do, and you can't memorize something and then remember it in an emergency. Instead, I want to help you think through logically, okay, what do you actually need to know, and what do you actually need to do and why? Now, it's not every detail. If you want all those details, go take some other first aid course. Instead, I hope you'll come out of that class ready to be confident and know why you're doing what you're doing, so that when something does happen, because it will, we're humans and we're kind of squishy and vulnerable, you'll be ready for it. All right, so let's get started. So the first step in making a first aid kit is figuring out why you're making the first aid kit. Where are you going to be when you're using it? What is the context? Is there going to be running water there? Are you going to be able to call for help easily? Would it be a situation where people have to walk or hike or somehow get out of the situation on their own or get rescued by a helicopter or something? Or is it a really civilized area where you can just sit there and wait for help to come? All of those are going to change what it is you have with you. You also need to ask yourself, how much space do you actually have to carry your first aid kit? If it's just for a backpack or a purse, you're not going to bring very much. But if you're going camping and you have some backpacks, especially car camping where you have a bunch of stuff, it's worth it to bring like a real first aid kit so you're prepared. If you're backpacking, it's going to be a very lightweight and carefully chosen set of items that you'll need for that specific situation. If it's in the back of your car, it's going to get really hot. And so you have to think about, okay, what is it that's going to survive the heat of the car? Each of those situations is different. Also, you have to think about who's using it. Is it going to be you? Is it going to be one of your kids? Is this something that's going to be available to other people who may not know what's in it or how to use it? Each of those is going to change what it is that you're using. Next up is to think through how you will actually be using each item in your first aid kit, and make sure you have everything with you that you need in order to make that item work. So if you have a wrap gauze or sterile gauze, do you have something to hold it on with? Some non-adhesive dressing or some tape or something that's going to work to keep it there. I don't personally carry butterfly Band-Aids. You may have seen them. They're like little strips that are supposed to be used to hold wounds closed. I don't carry them with me in any first aid kit that is going to be away from soap and water, because you need to thoroughly clean, and preferably with something that's antimicrobial in order to close up. Though there's a very high risk of infection and wounds that you close. And so as physicians, we never stitch something closed unless we can completely clean it. So at home, I have everything I need to completely clean something. But, if I'm somewhere else, I don't. So I'm not going to use that. My goal would just be to stop the bleeding and then decide from there what to do. The next question you need to ask yourself is how you will be transporting this first aid kit. If it's in your house, it's just going to sit there in your bathroom or a closet, then you don't have to worry about it. It's going to be just fine where it is. That said, it can be handy to have a smaller first aid kit of things you might need someone to grab for you. When my kids were younger, they got a lot of splinters. And so I had a splinter kit that I could just send one kid to go grab it while the other kid was screaming and I was trying to calm them down, because I didn't want a small child to be hunting through looking for things. Nowadays, my kids are big enough that everyone knows what to get and how to use it. And so I don't really have those kind of kits put together for the home. But if we're out and about, I do have kits that I'll drop in my purse or in someone's backpack, depending on what they need. It only takes a minute to put them together, and it makes life a lot easier in those situations. Now, beyond the house, think about where you're going to be going. If you're going to put together a first aid kit for a car, a toolbox or tackle box is nice because you don't have to worry about how clumsy it is to carry around. It is easy to grab and pull out of your car if you need it, but also it's really sturdy to hold up to being bounced around inside of your car. If you're biking, you want something like a fanny pack so that you have your hands free and you'll actually bring it with you, because a first aid kit that you bring with you is always better than a first aid kit that you don't. So even if that's not ideal, you'll have the basics of what you need. For my son's ballet bag, I have a little zippered pouch, kind of like what he keeps other things in, like his makeup or stage necessities. And one of them is just for first aid stuff. And in that case, it just drops in his backpack. For my daughter, for Scouts, she has a little tin that she can put in her backpack for hiking, but then has a bigger kit for when she goes camping. Now, the camping kit and the hiking kit are nice to put into something like a Ziploc bag because then it's waterproof also. Plus, Ziploc bags are always handy to have around. So if need be, you can dump out the first aid kit into something else and use the Ziploc bag if you need plastic. For example, if someone amputates a finger or something. Hopefully you don't need it, but if you do, it's there. The next important point with a first aid kit is you should make sure that everyone who's going to use that first aid kit knows what's in it and how to use it. For me, that means making sure that each of my kids can take everything out of that first aid kit and explain it to me and when they would use it and which things are safe to share with other people. My son in particular likes being able to share with the other dancers, and he knows there's some things like his prescription migraine medicine he cannot share. But there's other things like the nail repair bandages that most people don't have and are really pretty awesome. And so he shares those pretty frequently. So depending on which item it is, there's some things he can and cannot share. So besides going through how to use it, we also go through which things are okay to share with other people, because some kids just love sharing and there's some things they really shouldn't share. The next important point with putting together a first aid kit is making sure that anytime you use something, you replace it right away. You may not plan on using that kit again for a while, but it's better to just right away take care of it so that you're ready just in case. The idea with first aid is just always being ready, not having to figure it out when the time comes. That can be easier said than done if it's something your kid carries around. So, for example, my son in his dance bag, my daughter in her Scout things. Now, my daughter's very responsible. She's a Scout, always be prepared. And BSA Scouts really hammers that home for them. So she is very, very good about replacing things. My son, on the other hand, not so much. So when I go through his first aid kit, I often find wrappers from used Band-Aids and empty tubes of things, and discover that a lot of things need to be replaced. So I go through his probably about once every couple months, anytime I think of it, to make sure that he has everything that he needs. As he gets older, I'll probably make him go through it. For myself, my purse, the household, things like that, I can usually keep pretty good track. As soon as I use something in the house, I make sure to put it on the grocery list. I always have a backstock just because that's me. I like to always be prepared. My daughter takes after me. And so that way I never run out of things that we need. The next important point with a first aid kit is to make sure that even if you never use it, you go through it at least a couple times a year. I like to link it to something that we're already doing. If you live in a place where you change your clock twice a year, that's a great time to change the batteries in your fire alarm or smoke alarm, and also to switch out everything in your first aid kits that may need to be replaced. It's a good time to check for anything that expired, that's damaged, or has been used without your knowledge. You can also update it if your life has changed at all and you realize like maybe you don't need diaper cream anymore, but maybe you now need acne treatment. Who knows? It all depends on what's going on in your family and what you want to carry with you. If you don't change clocks where you are, some other things you could tie it to would be people's birthdays. So like my daughter and I have birthdays about opposite in the year, so they're good times for us to remember things that are opposite sides of the year. You can tie it to the end of each semester in the school year. So there's a lot of different things you can use. Just make sure you find something that will remind you, or just put a calendar notification on and don't ignore it. The last important part of putting together a first aid kit is make sure you have important numbers prominently displayed on the outside of the first aid kit or easily found inside of it. If you have kids in particular, poison control is a very important number to have. Now, my lessons go to people in different parts of the world, so I'm not going to tell you the poison control number for where you are, but make sure you look it up. Poison control is invaluable if somebody swallows something or breathes in something or gets something on their skin and you don't know what to do, because they do know what to do and they're available 24 hours a day, 7 days a week, and are very nice about it. Even if, like I had happen, one of my children ate things all the time. And so I felt like I was a negligent mother, but no, there are just some kids who eat stuff. So make sure you have those numbers. If your local emergency number is not a simple one like 999 or 911, then make sure you have that written down also. I like to keep the local non-emergency number available as well. So most municipalities have both an emergency number and a non-emergency number that often will go to the same dispatcher. So what you're doing when you call the non-emergency number is you're saying, I need help, but if there's someone who's having like a really big emergency, they can go first. And so, for example, I've called the non-emergency number if I found someone who was probably using substances who was passed out on my sidewalk. There was no emergency. He was fine. But I also needed someone to come figure out what was going on and help him because that was outside my scope of responsibility. So that was the time I called the non-emergency number compared to the emergency number if you're having a true emergency. So one time someone was struck by lightning on the end of my block. Great time to call the actual emergency number. The emergency dispatchers are wonderful. They can talk you through basically any situation. So if you're ever thinking about calling, just call. Because if you're thinking about calling, you probably should have already. They can tell you if you don't actually need to talk to them. The EMTs who come can tell you if you don't actually need to go to the hospital. That's their job, not yours. Now I'm going to talk about the contexts in which you might need to use a first aid kit so that you can be thinking about the ones that you put together. Everyone has different needs depending on what your family is doing and also what your children are capable of. If you have a 2 or 3-year-old, they don't need a first aid kit unless they're like my daughter, who liked to be prepared from the time she was able to be in any way aware of that. And she liked carrying what she would need with her at all times. So that's just her personality. If you have a kid like that, make them a first aid kit. Or if you have a kid like my son, they're fine without it. He didn't carry any sort of first aid kit until he started dance. And at that point, I started making him carry some basic necessities that he might need at dance. I personally always carry a kit in my purse for literally everything anyone in my family might need at that moment. So it's not a lot, but I'll show you in a minute my little pill box for prescription medications and over-the-counters, where I carry migraine medicines for everyone in the family and allergy medicines for those who need it, cough drops. If anyone's on an antibiotic, I'll put one of them in there in case we forget to give it to them. It's kind of the family place. But I use the same kind of boxes for other people in my family to put their own things, and they don't carry everybody's. But that's part of being a mom. The first context I want to talk about is home. Now, a lot of people don't think of the home as being a first aid kit, or they think of a first aid kit at home as being the same as a first aid kit everywhere else. But the reality is at home, you have a lot more space typically. Now, you probably should not keep your first aid kit in your bathroom unless that is your only choice. Now, where I live, it is not humid at all. We live in a very dry climate, and it does not get very humid in the bathroom. And if it does, it's for about 2.5 minutes, because as soon as you open the door, everything's dry. And so we don't need to worry about things getting too hot and humid. But in some people's houses, that could actually damage things. So think about where you're keeping it. In general, these kinds of things are good to keep in a closet or a kitchen cupboard or someplace like that. In our house, the bathroom is actually the most space that we have to put it because we don't have closets and our kitchen's very small. Our house was built in 1920. So as you're putting things together, you can think about a first aid kit for your house that you can grab and go if you need it. But mostly I want you to be thinking about your house as being more of a home apothecary, where you have kind of all the things that you might need in various situations. Now, you don't need everything, and definitely don't go out and buy everything now. But as you need things, you can organize them and keep track of them and make sure that they're there the next time you need them. I mentioned earlier that in my home, I don't have a specific first aid kit because my kids are old enough that they're able to just get the things they need. When they were younger, I had just a regular food storage container that had kind of a kit for splinters. So it had fine tip tweezers. It had actually a little razor blade because you can sometimes cut along the top of it. Maybe not something I'd suggest for everyone, but as a physician, something we do. It had some ointment. It had some sanitizing things, different things we might need, a little pair of pointy tip scissors, everything I could think of that we might need for a splinter. That way, when a kid did get a splinter, the other child could go run and get it and not have to be sorting through finding things. Nowadays, they don't get very many splinters, and I don't have that. But if we were to start having people to our house with young children who got splinters again, then we would go ahead and put that back together again. What I like about having everything ready in my home is anytime someone needs something, we can just grab it. I'll tell you, when moms come over with their kids, they're not as impressed by like the mud pit, which is a lot of fun, or the climbing wall we built, or anything like that. They're really impressed by my bathroom and my first aid capabilities because whatever their kids need, I usually have it. Not because I'm a doctor, but because I like to have things organized and findable and be prepared for these situations, like my daughter. So I'm going to give you a quick tour of my bathroom so you can get a look at what I have there. Now, none of this is a suggestion. It's just what I have. You might want different things in your bathroom or in your closet or your kitchen, wherever you put your home apothecary. Remember to think about what your family needs. If you have people in your family with particular problems, you'll want to make sure you have more of that kind of thing. Remember, too, to put things in a way that you'll be able to find them later that makes sense for you. The organization I made is what makes sense for me, but your brain may work differently. So make sure you organize it in a way that makes sense for you. All right, here we are in my bathroom, not usually where I film videos. It is our house was built in 1920, and so it's kind of an odd shape and size. So we bought these cabinets years ago because they're the only thing that fit in this space. So I think they're like 4 inches deep. And I'm going to show you reality here because normally you look at YouTubers, you look at bloggers, they're going to show you the absolute perfect thing at the beginning. I'm going to show reality here. So first of all, kind of a stepping back look. There's cupboards up above with mostly backstock, but a few other things. We have those on the right and left. We have like personal stuff. We have our toothbrushes and so forth. Over there, we have thermometers and pulse ox, cotton balls. Down below, we have towels and washcloths and things like that. So looking then at these shelves, you can see everything's kind of labeled, not always accurate. Bugs and sun protection, treatment, lotions, does not include any lotions, but it does have Miralax. Derm protection, antifungals, which does have those, has things like numbing spray here and Vaseline, but we also have like nail polish remover and Tide to Go. And then here we have nail care and Band-Aids. This thing here is used all the time. I don't know why it's on the bottom, but that's a nail repair bandage things for when you break a nail. And I don't know why Kleenex is in there. This is kind of a cough and cold. You can see a disaster. That's how it always is. And then up above it, some cough and cold wandered up there, pain relief, fever reducer. But we also have like azo for bladder stuff. We have some tubes of stuff that came down from above. There's our tubes of stuff. And then there's GI and eyes. Now, something I've done in here is anytime there's something that would go well with something, like for example, that there is electrolyte powder. So I know I'd look for it in GI if my kids were sick because that's a GI problem. Here, those are eye cups, but right behind them in that pill bottle is an eyeglass repair kit because I know I'd look for it there. And like up here, that box there is a prescription medicine that keeps people from throwing up that we use for migraines around here. But again, it's a GI thing, so I know I'd look for it there. Up above there, I have The MSK is just like wraps and bandages and ace wraps and ankle braces, and basically every brace we've ever worn. And we just hang on to them for just in case. So that is my bathroom. And that's reality. Bit of a mess. But in general, I have whatever I need if someone's hurt or sick or needs something. And while it doesn't look pretty, it's very, very functional. And that's the goal of any first aid kit or home apothecary setup, is to make sure that you have what you need, not necessarily that it's pretty. Quick note on over-the-counter medications. There's a lot of medications that come in combination. They might be called something like cough, cold, and flu, or nighttime sinus relief, or something like that. They all have a combination of basically the same medicines in them. And while it's fine to buy those, that's why they're FDA approved in the United States or whatever they're approved of in your country. I personally, though, keep each ingredient separately and give each ingredient that is actually needed. Oftentimes in those combination medications, they might have something you don't actually need, or you end up purchasing a lot of different ones trying to find the right combination for your particular mix of symptoms when you could just take them separately. So if there's a favorite one you use all the time, go for it. But if not, it can be very handy having them separately. Another problem with the combinations is that people can sometimes accidentally overdose, especially with children. There are some medications like Tylenol, or acetaminophen or paracetamol, depending where you are, that can kill your liver. And people can accidentally take too much because there'll be some in the combination medication. They might take some just on its own because they're not feeling good, and pretty soon they get too much. It can also happen with certain cough medicines. Especially in young children, certain cough medicines can make people not breathe as well. And so that's another thing you have to be very careful about, is not giving young children too much of any of the medications that might affect their breathing. What we do in my family is if anyone is sick and taking medication, is we always text someone else with when the dose was. Now, if it's kids, then the text goes to all the adults in the house so that we all know when each kid had a dose. Even for adults, though, I'll text either my husband or Hannah, my friend and assistant, so that they know exactly when I took a dose and I know exactly when, so that when I need another one, I can make sure I'm not overdosing myself. So that makes sure that we're taking the right amount of everything. I also make sure on all the packaging to write the correct dosing for the kids, because my daughter is still young enough that her dosing is based on her size, and she's not able to take the same medicines the rest of us can. My son's 14, he's basically the same size as me, so he can take the regular doses. But for my daughter, she has to have a particular dose, and she often has to have a different form. And so I write her name and her dose on the outside of the box, so that everyone who uses that medicine with her gives her the right dose. I want to make sure that we definitely don't ever give her either too much of something, which can be dangerous, or too little, because then it doesn't work. And so why would we bother giving it to her if we're not giving her a therapeutic dose? So just a few little side notes and tips on over-the-counter medications and safety. Now I want to talk about specific situations where you might make a first aid kit, where you can pull from that main family apothecary into a container that you can take places with you. So I'm going to show you my son's ballet first aid kit just because it was an easy one to grab and bring in here. The one in my purse is actually distributed in different pockets in my purse because I have different things that I carry with me for different people. So that was hard to grab. And this one was just sitting there in his backpack, so I grabbed it. So let's go through his real life first aid kit and see what a mess it is. Here is my son's dance first aid kit. This one's, I think, an old sewing or knitting notions kit of mine that I took apart and used the bag for him because I didn't need it. But really, cosmetics bag, all sorts of things work. So I use sandwich bags for organizing his stuff. You can see that. We'll go through what all this is in a minute. All right. So I think we can kind of see everything now. So I have here a bag of Band-Aids, blister Band-Aids, moleskin, everything he might need for those kinds of things. So blister Band-Aids, he has some safety pins in there just because it's a bag and a good place to put them. But safety pins are good for holding things on or in case his clothes tear it just seemed like a good place to put them. I do have the wipes for if he spills anything on himself. These are the nail bandages. They go right, you can't really see, but they're almost like cloth, and they go right onto the nail, and then you trim the edge. He has a pair of scissors in a different part of his bag where he can just trim it, or all the girls have scissors for their point shoes. So he can always borrow a pair. This is KT tape for any injuries that he might have. He can tape them. An ace wrap, you can see this one's unused. It has Velcro, so it doesn't have those little pointy clippy things that he can use. Muscle rub. This is his personal pill minder that I mentioned. So these things are awesome. They come open like that, and then there's labels for each thing. And for his, I label it with when he should take it, how much to take, why he should take it, so he knows what it is. He already does know, but just for a reminder. We have Afrin in case he gets a nosebleed or his nose is getting runny at all, or his allergies. This is for his allergies because he only thinks about using his nasal steroid when he's at dance. So there you go. He has braces. So we have his mouth rinse, which you can see he's probably never used, even though he's supposed to. Somewhere in here, there we go. Here's our little braces care kit. We love the Orthodots. This is not an ad for them at all, but if you have a kid with braces, they changed our life. Because if you're like us, you were given wax, and it's awful because you have to have it completely dry or it doesn't stick. Orthodots, just a little side note, are fabulous because they specifically stick better when on wetness. So it's really easy for my kids to put on themselves if they're out and about and their braces are hurting them. And then this is just a little chew thing that if he bites down on it can make his teeth feel better. He doesn't have asthma per se, but if there's smoke from wildfires or something, he'll often need an inhaler. And what else do we have? Googly eye. And clippies from his last ace wrap that he already used, random stuff. All right, so there is a real first aid kit that is obviously used regularly. And mostly I just restock throwaway wrappers, things like that, every couple months. And hopefully over time, he'll take that job on himself. And he's my kiddo who shares a lot. So we do go through more than we would otherwise. But I figure it's a good way of making friends and helping people out. And I want to encourage him to help people. So that's in the end a good thing. Though it does mean we buy a lot of blister Band-Aids because ballet. I don't have my daughter's Scout first aid kit with me because she just got back from a camp out and everything is a disaster. So I'd have to dig through all of her bins of stuff that she just dumped in the middle of the living room. But I will tell you the big difference with that one is we assume that there will be no running water. So at ballet, there's always soap and water available. They have an ice machine. I mean, it's set up already. They have crutches for the kids. It's set up for injuries already. Whereas camping, you're going to have to make do with what you have. One of my favorite secret things, not secret, but like tricks of the trade, is I have a roll of duct tape. Now, not the giant heavy roll, but you can just peel off some tape and then make it into its own little roll. It'll re-stick really well. And that's something you can use for almost anything. So you can make a splint or a brace or all sorts of slings and things with just a little bit of help with duct tape. Because if you're outside, there's sticks and stuff. So that gives you your long, hard thing. And then if there's humans, you always have shirts and jackets and sleeping bags, all sorts of things you can cut or tear up if you absolutely have to, or just use as is usually. So that when you're done, you just clean it, you get your shirt back. So that's the big difference with making a camping one. I hope this has been helpful thinking through how to make a first aid kit. My next suggestion is to download the PDF. It has a list of lots and lots of things that I have in my own bathroom or for camping or dance or in my purse, different situations, which again is not medical advice and not something you should have, but to get you started. And think about what you would need in your life for your family. Different people need different things. Consider also putting together a pet first aid kit. I'm not a veterinarian. I'm not going to make any suggestions on that one, but I will tell you that I have a couple animals on prescription medication. And so we have to have some of that ready to go. We also have an emergency halter and leash by the front door for my dog. So occasionally my kids don't put things away where they're supposed to, and we have to hunt everywhere for his leash and his harness. So what I did is I bought the same harness he always wears in bright red and a bright red leash, and that always stays right by the front door no matter what. That is in case of emergency. We can always put that harness on him, and we don't have to worry about having to hunt for one, because in an emergency, if there's a fire, whatever, we need to rush him to the vet. any situation, we want to be able to just put it on him and go. Thankfully, we've never needed it for a true emergency. I have used it for just a routine vet visit when we were running late and could not find his harness and leash. But otherwise, we have not needed it. I also put his tags on that harness instead of the one that he wears when he's, our usual day-to-day one, because I figure in an emergency is when he needs his tags showing his vaccinations and who he is and how to get a hold of us and his vet and all that kind of stuff. So that's the one that has his tags. For our cats, we have 2 big carriers, and we know which 2 cats are best to put together in which carrier. So if we need to, we can shove the cats in the carriers and get out. We're in a place where we don't have a lot of like floods and fires and things like that. So I'm probably not as prepared as I should be. If I was, then I would also have kind of a bug out bag for the animals with some basic necessities. The nice thing where we live is we have family all over the metro area where we live. So we could just go on the opposite side. Whatever was happening on this side wouldn't be happening on that side. And they all have pets too. So they could just hook us up with most of what we need. Though we do have a cat on a prescription food that I should probably make sure is ready to go just in case. So just some other things to think about as far as first aid preparedness. And if you're interested in how to use all these things and understanding why and how different first aid suggestions are there, feeling more prepared and confident in these different situations, then you can always follow me along with the full first aid course. But even if you never do, just having this first aid kit is going to make you so much more prepared than the average person and feel just a lot better knowing that you're ready for whatever situation may come along for yourself, for your family, and for your community.